Welcome to the Deep Dive Ortho. Our mission is always to cut through the noise, to really deliver the crucial insights that can genuinely reshape your clinical practice. Today, we're embarking on a deep dive into what is, well, unequivocally a foundational text for anyone navigating the complex world of orthopedic and sports medicine. It's a publication so impactful, it's been setting the standard for decades now. We're talking about the recently updated Clinical Sports Medicine Foundations of Clinical Practice, the sixth edition. Our aim is to unpack exactly what makes this updated work such an indispensable cornerstone for professionals like yourselves, and crucially, what fresh perspectives it brings to your daily practice. To guide us through this intricate landscape, I'm absolutely delighted to be joined by Professor Mo Imam. His profound expertise will help us distill the most important nuggets of knowledge this new edition has to offer. Consider this your fast track to understanding its practical value and really its profound impact.
It's a genuine pleasure to be here, and yes, to delve into a text that has truly shaped generations of clinicians. I'm looking forward to highlighting why this edition is, I think, more vital than ever.
Indeed. Now, Professor, this isn't just another medical textbook, is it? It's the sixth edition of a series that's consistently remained right at the apex of its field. For those of our listeners who might be new to it, perhaps, are fresh out of training or just stepping into sports medicine, could you lay out precisely what Clinical Sports Medicine Foundations of Clinical Practice is? And what pivotal role does it play for the medical professional? What gap does it fill that perhaps other texts don't quite manage?
You've really hit on the very essence of its significance there. Clinical sports medicine isn't merely a textbook. It holds the distinction of being widely recognized as the longest-running and, well, arguably the most authoritative sports medicine textbook available globally. Its longevity, now into its sixth iteration, that really speaks volumes. It's a testament to its enduring relevance, its ability to consistently evolve with what is, let's face it, a rapidly advancing field. For decades, it has been the definitive reference, the trusted compass for countless clinicians navigating the complexities of sports injuries and patient care. Its status isn't just about comprehensive content, it's about the confidence it instills in practitioners. At its core, as the publication's own description amply highlights, this is an incredibly practical guide to physiotherapy and musculoskeletal medicine. But to truly understand its unique niche, we need to look beyond that general description. This specific volume, Foundations of Clinical Practice, is meticulously structured. It's designed to guide clinicians, especially those just starting their careers, maybe new graduates or junior registrars, on how to cultivate a genuinely patient-focused approach.
That patient focus seems key.
It is. It's a crucial distinction. It moves beyond simply diagnosing a pathology or understanding a biomechanical issue. Instead, it guides the practitioner to see the individual experiencing that pathology within their broader context. Their life, their goals, their psychological state, their social environment. It's about developing that crucial clinical mindset, those nuanced interpersonal skills vital for truly effective patient interaction and care. It really shifts the paradigm from just treating an injury to rehabilitating a person.
Can you give an example of that?
Certainly. For instance, the book doesn't just describe how to assess, say, a knee injury. It delves into how to communicate prognosis effectively, how to manage patient expectations, or how to identify and address psychological barriers to recovery that might not be immediately obvious, things that can really stall progress. The book lays out the fundamental clinical sciences that underpin our entire field. This encompasses everything from detailed anatomy and biomechanics through to understanding tissue pathology and the complex physiological responses to both injury and exercise. What's exceptional is how it integrates these elements. It doesn't present them in isolation, but rather illustrates how they collectively inform our understanding of patient presentations and guide our decision-making.
Right, so it connects the dots.
Exactly. From this robust scientific grounding, it then meticulously details the principles of assessment, how to accurately diagnose, differentiate, understand the severity, and critically, the principles of multidisciplinary treatment.
The multidisciplinary team. Always crucial.
Absolutely. And for our audience, that concept is well understood. But what this book offers is a practical framework. It acknowledges that no single clinician holds all the answers. Optimal patient outcomes invariably require collaboration across various specialties: physios, sports physicians, orthopedic surgeons, S&C coaches, psychologists, even nutritionists, all working together.
Seamlessly, ideally.
Ideally, yes. This volume specifically teaches the foundational elements required to be an effective, contributing member of such a team. Understanding your role and, crucially, how to integrate your expertise with others for a truly holistic approach. It's about knowing not just what you do, but how your piece fits into the larger puzzle of patient recovery. The intended audience is also very precisely defined, which I think is a significant strength. It's specifically targeted towards new graduate sports medicine doctors, sports rehab professionals, physiotherapists, and sport therapists who are just entering the field.
So it's very focused.
Very focused. This clarity ensures the content is exceptionally relevant and immediately applicable for these groups. It gives them the essential groundwork they need to confidently step into clinical practice, equipping them with the fundamental knowledge, the evidence-based reasoning, and the practical skills to begin their journey. It really acts as a compass, guiding them through those early, often quite overwhelming, stages of professional development, setting them up for long-term success.
That deep emphasis on understanding the patient as a whole and truly integrating that multidisciplinary approach rather than just, paying lip service to it clearly sets this book apart. It sounds like it's fostering a more nuanced, perhaps more empathetic practitioner. Now, this is the 6th edition, and we understand it represents a genuinely significant evolution. The shift from a huge, comprehensive single volume to a dedicated 3-part series, that's a monumental structural change, isn't it? What are the major structural and content innovations in this new edition that clinicians, particularly those perhaps familiar with earlier editions, should be keenly aware of?
You're absolutely right. The structural change is perhaps the most immediately impactful and, I'd say, strategic innovation in this new edition. Previously, Clinical Sports Medicine was indeed a single, often rather overwhelming book, sometimes stretching to well over 1,400 pages, which, while comprehensive, the sheer volume could be quite daunting to navigate, especially for a student or a busy clinician trying to quickly reference something specific in a high-pressure environment.
I can imagine. Just finding what you need quickly must have been a challenge.
Precisely. Now, in what I think is a truly intelligent and user-centric move, it has been divided into 3 separate, highly specialized volumes. The strategic benefit of this division, for both the learner and the seasoned practitioner, is enormous. It allows for much deeper, more focused dives into specific areas without overwhelming the reader with information that might not be immediately pertinent to their current learning or clinical focus.
So more targeted.
Exactly. For instance, if your primary interest is the foundational principles of clinical practice, you now have a dedicated volume just for that. If you're focused on the intricacies of injury management, there's another. This modular approach is far more digestible, practical, and, frankly, efficient for real-world application. It lets clinicians rapidly access the information most relevant to their immediate needs and build expertise progressively.
Okay, so focusing specifically on this Foundations of Clinical Practice volume then, what's new inside? You mentioned transformative content.
It really is. There are 16 entirely new chapters, and these are far from just additions. They represent a significant shift in focus towards the, let's call them, meta skills that define a truly excellent clinician in the modern era. For example, you'll find dedicated chapters on how to be a better clinician. This goes beyond pure technical skills. Well, it delves into critical areas like advanced communication strategies, how to build deep patient trust, the nuances of clinical reasoning under pressure, and the cultivation of empathy. Imagine a patient presenting with persistent, unexplained pain. This book provides frameworks for understanding not just the potential physical causes, but also the patient's fears, their beliefs, and how those can profoundly influence recovery. There are also new chapters on how to interpret clinical sciences, which is absolutely indispensable in an evidence-based practice world.
Right, moving beyond just reading the abstract.
Exactly. It empowers clinicians not just to read research, but to critically appraise it, understand its limitations, assess its applicability to individual patients, and effectively translate complex scientific findings into practical, actionable advice. It addresses that common challenge: how to move beyond merely knowing the evidence to applying it wisely. And finally, chapters on the principles that underpin quality clinical practice. These delve into ethical considerations, professional responsibilities, systems thinking, all necessary to elevate good practice to exceptional practice within a complex healthcare system. This demonstrates a clear, explicit shift towards not just what to do, but how to excel in every facet of clinical practice, from the initial consultation right through to long-term patient support.
And the actual content within the existing chapters, has that been updated too?
Oh, absolutely. What truly underlines the authority and currency of this edition is that all chapters have been meticulously reworked from scratch.
From scratch. Wow.
Yes, by an immense collaborative effort involving 90 world-leading experts. This isn't a superficial update with minor edits. It signifies a monumental commitment to ensuring every piece of content is as current, evidence-based, and comprehensively reviewed as humanly possible. Having such a vast array of leading experts contribute means the book benefits from a broader spectrum of global perspectives, cutting-edge research, and deep clinical experience. It ensures the material is robust, impartial, and reflects truly global best practices.
That diversity of input must be invaluable.
It really is. It also means that complex or controversial topics are often presented with nuanced views, allowing you, the clinician, to understand the breadth of current thinking. And to enhance usability and learning retention, significant learning aids have been seamlessly integrated throughout. Every single chapter now thoughtfully includes a clear chapter outline, precise learning objectives, and concise key points summaries.
That sounds incredibly useful for a quick reference or revision.
It's a godsend for busy professionals. It helps you quickly grasp the scope of a chapter, identify the core takeaways, and efficiently review the most important information. It makes targeted learning and retention incredibly efficient.
You mentioned a modern approach earlier, particularly biopsychosocial.
Yes, and that's another absolutely critical update. The profound emphasis on a modern approach to the biopsychosocial principles of sports injury management and rehabilitation. Historically, sports medicine often focused predominantly on the biomechanical or physiological aspects of an injury, which are vital, of course. However, contemporary understanding unequivocally recognizes that injury and recovery are deeply influenced by psychological factors, things like fear avoidance behaviors, anxiety about returning to sport, self-efficacy, motivation, and also by social factors like family support, access to resources, cultural background, the specific demands of an athlete's sport or personal life. This biopsychosocial framework isn't just mentioned, it's woven into the very fabric of the entire volume.
Can you illustrate that?
Sure. The book might present a case study, perhaps a runner with persistent Achilles pain, where a purely physical approach has failed. It then guides the clinician to explore the athlete's perfectionist tendencies, maybe their identity being heavily tied to running, or perhaps financial pressures they face. It provides practical tools like pain neuroscience education or motivational interviewing techniques to address these often overlooked but crucial elements. This leads to more effective, truly patient-centered care and ultimately better long-term outcomes.
So treating the individual with the injury, not just the injury in isolation.
Precisely. And finally, the sheer abundance of practical elements in this edition is truly remarkable.
Such as?
Well, the book includes 87 practice pearls. These distill decades of cumulative clinical experience and wisdom from top clinicians into actionable, concise advice. Imagine the most valuable insights from thousands of patient interactions boiled down into easily digestible nuggets you can apply immediately.
Little gems of wisdom.
Exactly. Then there are 380 figures in total, with a staggering 280 of these being entirely new to this edition. Visuals are paramount in medicine for understanding complex anatomy, demonstrating assessment techniques, or illustrating rehab exercises. The new figures ensure this volume is visually rich, clinically relevant, and incredibly clear. You'll also find 74 feature boxes dedicated to advanced clinical issues, allowing you to delve deeper into specific topics or controversies without disrupting the main flow.
That sounds useful for digging into niche areas.
It is. And perhaps most innovative and exciting are the 69 QR codes embedded throughout the book.
QR codes in a textbook.
Yes, offering hours of additional multimedia content. These codes can link directly to videos demonstrating specific assessment techniques, detailed rehabilitation exercises, or even exclusive interviews with experts discussing challenging cases. It provides a multimodal learning experience that goes far beyond the static page, offering immediate practical value and catering to diverse learning pathways. It makes the book exceptionally user-friendly and highly engaging for the modern clinician.
That's an extraordinary amount of detail and practical application woven into one publication. It truly sounds like a paradigm shift in how information is presented for learning and immediate use in a fast-paced clinical setting. And speaking of authority, the true power of any foundational text often stems from its architects, doesn't it? Peter Bruckner and Karim Khan are undeniably luminaries in this field, figures whose names resonate deeply within sports medicine. Could you share a bit more about their individual backgrounds, Professor, and crucially, how their combined complementary experience profoundly informs the depth, utility, and unique perspective of this publication? What distinct flavor does each bring, would you say?
That's a wonderful question. The authoritative and comprehensive nature of clinical sports medicine is indeed inextricably linked to the extraordinary expertise and, I think, the synergy of its lead authors, Peter Bruckner and Karim Khan. They are, without a doubt, titans in the field of sports and exercise medicine. Their combined experience provides an unparalleled foundation for this work. Let's begin with Professor Peter Bruckner. He is, first and foremost, a highly respected sports physician and an associate professor in sports medicine at the University of Melbourne. His clinical acumen is immense. This is underscored by his role as a founding partner of the Olympic Park Sports Medicine Center, recognized globally as a premier institution for elite athlete care.
So very hands-on, high-level experience.
Extremely hands-on. This isn't just an academic affiliation. It means he was deeply embedded in the practical, day-to-day challenges of managing high-performance athletes. Beyond individual patient care, his leadership roles are incredibly significant. He's a past president of the Australasian College of Sports Physicians. That speaks volumes about his influence and the respect he commands. And crucially, he has served as an Olympic team physician for Australia.
Right at the sharp end, then.
Absolutely. This signifies being at the absolute coalface of elite sports, responsible for the health, injury prevention, and performance of athletes at the very highest levels. Imagine the pressure of managing a complex injury for a gold medal favorite just days before their event, or navigating the medical needs of an entire team across continents. Professor Buckner's extensive clinical and organizational experience, particularly at these elite levels, absolutely infuses the practical wisdom throughout the book. He understands the real-world demands, the intricate nuances of athlete psychology, the subtle cues of overtraining, the critical multidisciplinary coordination needed.
That practical wisdom sounds invaluable.
It is. When you read something in this book, you intuitively know it's coming from someone who has lived and breathed these scenarios, someone who has had to make those split-second high-stakes decisions. Then we turn to Professor Karim Khan. He's a distinguished professor in the Department of Family Practice and also holds associate memberships in physical therapy and orthopedics at the University of British Columbia. What makes Professor Khan's contribution so exceptionally powerful is his unique combination of active clinical sports medicine practice alongside a prolific and, frankly, groundbreaking research program.
Clinician and researcher, the best of both worlds.
Precisely. His research focuses particularly on areas like tendinopathies, notoriously challenging to manage bone health, and the precise evidence-based science of exercise prescription. This blend is incredibly valuable. He isn't just a clinician applying existing knowledge. He's actively contributing to the creation of new knowledge through rigorous scientific investigation. This means the material he helps present is not only clinically relevant and practical, but also cutting-edge and scientifically robust, reflecting the latest advancements.
So, grounded in the latest science.
Absolutely. For example, his work on tendinopathy has been instrumental in shifting treatment paradigms, moving away from passive modalities toward active load management. You'll see these principles, grounded in his research, directly translated into the book's clinical recommendations, often with surprising nuance. He's truly at the forefront of understanding the cellular and physiological responses to exercise and injury, ensuring the recommendations are genuinely evidence-based.
So when you connect their expertise.
Yes, when you connect their expertise to the book's profound value, you truly see why it's so comprehensive and impactful. Professor Buckner brings that unparalleled breadth of elite clinical experience, the understanding of complex team dynamics, the practical demands. Professor Khan brings the intellectual depth of scientific inquiry, ensuring the theoretical underpinnings are sound, the latest research is incorporated, and the advice is truly evidence-informed, reflecting a deep understanding of biological mechanisms. There are diverse experiences, spanning clinical practice, academic research, allied sports medicine. It all contributes to the book's holistic nature and its unique ability to seamlessly bridge theory with real-world applicable solutions. They don't just tell you what to do, they provide the compelling why, based on both decades of practical application and rigorous scientific investigation. It's this synergy that really elevates the book.
That's a truly compelling portrait of why their voices carry such authoritative weight. It's not simply theory. It's deeply rooted in both the precision of the lab and the demanding high-stakes realities of the field. And that leads me to a really evocative statement we've seen in a review from a practitioner who works at the absolute highest level, someone who apparently literally travels with this book. The phrase was, "Everything is needed to take an athlete or team sports player from the plinth to the podium." That's incredibly powerful imagery. Professor, what exactly does from the plinth to the podium signify for the everyday medical professional, whether they're working with elite athletes or, simply helping someone return to recreational sport? And why is this level of all-encompassing comprehensiveness so critically important in modern sports medicine?
That phrase, from the plinth to the podium, it's as incredibly powerful because it encapsulates the entire, often quite nonlinear journey of athlete care. It's a vivid metaphor for the full continuum. For the everyday medical professional, whether you're working with Olympic hopefuls, local club players, or indeed the weekend warriors striving to get back to their fitness routine, This phrase perfectly illustrates the exhaustive scope of what the book delivers. The plinth represents that initial crucial stage of care, the clinical setting where the athlete first presents.
The starting point.
Exactly. This is where the vital work happens. Initial assessment, accurate diagnosis, differentiating subtle conditions, understanding severity, perhaps spotting a red flag needing immediate referral and immediate management. It's about identifying the precise problem, formulating that initial working diagnosis, initiating acute treatment, immobilization, pain management, early rehab. The book provides the foundational knowledge and the practical, nuanced guidance needed for this critical first step, ensuring clinicians can confidently make those initial assessments, differentiate complex presentations, formulate appropriate plans. It covers history taking, differential diagnosis, the evidence behind interventions.
Okay, so that's the plinth and the podium.
To the podium, then, represents the ultimate objective, successful return to and often enhancement of high-level performance. This encompasses the entire, sometimes arduous rehabilitation pathway, regaining basic function, strength, progressing through sport-specific drills, ensuring psychological readiness for return to play a vital, often overlooked aspect, and ultimately optimizing performance to achieve peak condition. Standing on that metaphorical podium.
Right.
Think of, say, a rugby player with a complex hamstring injury. The book guides you from the initial on-field assessment through precise diagnostic techniques, tailoring early rehab, then meticulously detailing progressive loading, sport-specific drills, psychological strategies to overcome fear of re-injury. It covers not just the physical, but the mental preparation needed to return to demanding contact sport at full intensity. This journey is inherently complex, rarely linear. It requires deep understanding of the injury, the athlete's sport, their goals, their psychology, the physiological and biomechanical demands. So the book covers everything needed across this entire intricate spectrum, not just the acute injury, but the long-term strategic management of health and performance, guiding clinicians through every phase with detailed, actionable protocols.
And that comprehensive nature is critical because
Because the reality of sports medicine is rarely straightforward. An injury doesn't occur in a vacuum. Rehabilitation is never just a simple linear progression. Clinicians constantly face comorbidities, psychological barriers, unexpected plateaus. You need a resource that can seamlessly guide you from that initial presentation through complex rehab phases, right up to the nuanced decision-making for safe return to competition, or even helping them exceed previous performance. The book's comprehensive scope ensures you aren't left scrambling for different resources for each stage. It's all there. An integrated framework for care, supporting decision-making at every turn.
the review also mentioned its practicality in the clinic.
Yes, that it's very easy to quickly check in the clinic. That's an enormous benefit for busy professionals in high-pressure environments. In a fast-paced clinic, you don't have time to wade through verbose text. The way this book is structured, clear learning aids, those invaluable practice pearls, intuitively navigable content means you can rapidly access expert, evidence-based advice exactly when you need it.
Like a quick consult.
Almost like having a senior consultant by your side. Yes. Confirming test interpretation, recalling a rehab principle, reviewing a management strategy for a less common condition. This immediate utility makes it an indispensable, highly efficient tool for day-to-day decision-making.
And the reviewer's background adds weight to that.
Absolutely. They specifically mentioned working in professional sport, including rugby union, Olympics, and Commonwealth Games at the highest level. This isn't just someone casually flicking through. This is a practitioner in the most demanding environments, where precise, rapid, reliable information is paramount. For them to say they always travel with this book when working, and it's a must-buy, is the highest possible endorsement. It shows that even at the pinnacle of the profession, this book stands out as a constant, trusted companion.
That's quite a statement.
It is. And finally, the reviewer's astute comment about the author staying up to date and current in this rapidly changing field is incredibly important. Sports medicine is dynamic, constantly evolving. New research emerges, understanding evolves, techniques are refined. A textbook that doesn't adapt quickly becomes obsolete. The consistent, comprehensive updates and refinements in clinical sports medicine ensure it remains cutting-edge, authoritative, providing clinicians with the most up-to-date best practices. This ongoing relevance gives clinicians confidence that the guidance reflects the very latest advancements, empowering them to provide the best possible future-proofed care.
That truly frames it in such a clear, actionable perspective, demonstrating how this series supports the entire patient journey from injury right through to peak performance. Thinking about building one's professional library, this volume, Foundations of Clinical Practice, is clearly essential groundwork. But as you mentioned, Professor, it's also part of a larger three-part series. For our listeners looking to deepen their expertise or perhaps specialize further, how do the other two books truly complement Foundations of Clinical Practice? What unique value does each bring to that comprehensive understanding of sports and exercise medicine?
That's a truly insightful question because understanding the complete ecosystem of the Clinical Sports Medicine series really reveals its holistic power as an unparalleled resource. While Foundations provides that essential intellectual bedrock, the core principles, the mindset the other two volumes build upon it, offering specialized, in-depth knowledge in distinct but interconnected areas. It's not just a series. It's more like a meticulously planned curriculum for comprehensive mastery.
Okay, so what's the first companion volume?
First, we have Clinical Sports Medicine 6E, Managing Injuries. If Foundations teaches you how to think like a great clinician, how to reason, communicate, adopt that patient-centered approach, then Managing Injuries is really the definitive how-to manual on diagnosing and treating sport-related injuries. This volume directly and practically builds on the principles from Foundations, providing comprehensive, step-by-step guidance for every aspect of injury management.
Getting into the real nuts and bolts then.
Precisely. It delves into precise assessment techniques for various body regions, outlines the intricate world of differential diagnoses for specific pathologies, and details evidence-based treatment and rehabilitation protocols with almost surgical precision. For instance, if you're dealing with complex shoulder instability, this volume wouldn't just cover the anatomy. It guides you through specific orthopedic tests, imaging interpretations, decision-making for conservative versus surgical management, and then offers detailed rehab phases, progressive exercises, return-to-sport criteria.
Very detailed.
Extremely. So once you have that robust grounding in patient-focused care and clinical reasoning from the first book, this second volume gives you the actionable blueprints, the granular detail for managing the vast array of musculoskeletal injuries you'll encounter. It translates theory, anatomy, biomechanics, pathology directly into practical clinical decision-making and precise, effective interventions. Physical therapy techniques, exercise programming, pharmacological considerations, guidance on referrals, all tailored to specific injuries. It's the playbook for practical intervention.
Right, that makes sense. And the third volume?
Then, brilliantly complementing both of these is Clinical Sports Medicine 6E, the medicine of exercise. This volume significantly broadens the scope beyond just injury management. It steps into the realm of general health, prevention, and systemic medical conditions. It's specifically designed for clinicians who prescribe exercise, not just for rehab, but fundamentally for health promotion, and those who manage exercise-related medical conditions. This is where sports medicine truly intersects with general medicine, public health, even population-level interventions.
So moving beyond injuries entirely.
Yes, or rather, seeing the bigger picture. This book covers crucial topics like the profound physiological adaptations to exercise, the undeniable benefits of physical activity for preventing and managing chronic diseases, diabetes, cardiovascular disease, osteoporosis, certain cancers. Critically, it covers how to safely and effectively prescribe exercise for diverse populations, including those with complex pre-existing medical conditions like cardiac disease or neurological disorders. It also comprehensively addresses specific exercise-related medical conditions, exercise-induced asthma, the very serious issue of sudden cardiac death in athletes, overtraining syndrome, burnout, vital nutritional considerations for performance and health.
So contemporary issues as well.
Absolutely. It delves into topics like the female athlete triad, the growing importance of mental health in sport, concussion management from a broader medical and public health perspective. This volume, therefore, completes the holistic picture by encompassing the preventative, systemic, and general health aspects of exercise, not just reactive injury management. It positions exercise as a powerful therapeutic tool and gives clinicians the nuanced knowledge to manage complex medical conditions influenced by physical activity. It might explore, for instance, how tailored exercise prescriptions can mitigate long COVID symptoms, or how to design activity plans for individuals with chronic fatigue, topics rarely covered with such depth elsewhere.
So the three together form a complete picture.
Exactly. When you consider the series as a unified entity, Foundations provides the clinical mindset and principles. Managing Injuries equips you with practical tools and protocols for injury care. And the medicine of exercise expands your understanding to the broader health benefits, preventative strategies, and complex medical considerations of physical activity. This modular yet integrated approach allows professionals to tailor their learning, diving deep where needed for their practice or specialization, while still having access to the full spectrum of knowledge. It's truly a complete library in itself, designed to support a clinician at every career stage and across every facet of the field.
We've covered a remarkable amount of ground today, exploring the profound updates and enduring value of clinical sports medicine, Foundations of Clinical Practice, 6th edition. It's unequivocally clear this publication continues to serve as an indispensable guide for any professional dedicated to sports medicine and rehabilitation, evolving dynamically to meet the increasingly complex demands of modern practice. If you found this deep dive valuable, we would be incredibly grateful if you would consider rating and sharing it with your colleagues. Now, as the field of sports medicine continues its rapid and exciting evolution, driven by new research and ever-expanding clinical insights, how might the profound integration of such comprehensive, practical guides shape the next generation of patient-centered clinical excellence? What does extending this plinth to podium philosophy even further into everyday practice, not just for elite athletes, but for every patient seeking to improve their physical well-being, truly look like in the years to come? Will it lead to more integrated care teams, or perhaps even redefine the very scope of what a sports medicine professional can achieve?
A truly profound and forward-looking question, one that beautifully highlights the enduring legacy and I think the transformative potential of work like this. I believe it sets the stage for a future where patient outcomes are elevated by truly holistic, evidence-informed care, integrated across disciplines perhaps more seamlessly than ever before.
Indeed. Professor Moimam, thank you so much for your incredibly insightful contributions to this deep dive. It's been absolutely illuminating.
My pleasure entirely. Thank you for having me.
And thank you, our listener, for joining us on the Deep Dive Ortho. Until next time, keep learning, keep applying, and keep excelling in your practice.